The healthcare industry is a $3.8 trillion industry. The average person spends $8,233 per person on health insurance annually. This is about $33,000 for a family of 4. Compared to other OECD countries, which stands for the Organization of Economic Cooperation and Development, which consists of 14 different countries, including Germany, France, Italy, Japan, Canada, and the UK, along with 8 other developed countries. The U.S. spends by far the most on healthcare. On average, the OECD countries spends $3,000 per person annually, and in many countries, a person will never receive a medical bill or ever go bankrupt from medical debt. The U.S. is by far the most technologically advanced. We are driven with researchers and money to pay for new tests and procedures to create drugs. We soar sky high within the realm of medicine. However, we pay the price. The average hospital stay costs about $18,000 in the U.S., compared to the other OECD countries, which is only about $6,200. That is a third of the cost of the U.S. And with over 47 million uninsured people in the U.S., a trip to the hospital could put them in debt for years. With the U.S. spending the most on healthcare in the whole world, we would expect the average life expectancy to reflect that statistic. However, the average life expectancy is 78 years, which is almost 2 years lower than the OECD average. You might ask, where is the $8,000 per person a year going to? The U.S. performs the most MRIs, CT scans, tonsillectomies, and hip replacements than any other countries. These are all minor procedures, but the price tag is large. To give you an idea of the average cost of a hip replacement in the U.S., it's $17,000. Where in Germany, it's only $9,000. A normal delivery of a baby in the U.S. costs about $4,500, as compared to Canada, where it costs about $2,900, and even less in Germany at $1,700. Healthcare systems all over the world have their strengths and weaknesses. One obvious weakness of the U.S. is that it has a lack of preventative care. A major issue is obesity. We see this problem in the youngest generations to the oldest generations in the U.S. The U.S. has the second highest rate of overweight and obese children within the OECD nations, with 37% of girls and 45% of boys. Obesity rates within the U.S. have raised 13% in the last 20 years. This is huge. Obesity can cause many healthcare problems, including heart attack and stroke, as well as diabetes and many other chronic health problems. With obesity on the rise, we are also seeing healthcare bills skyrocketing and more people falling into debt due to high healthcare costs. We hear these statistics and are still not getting the answers or help the U.S. needs to give its people quality healthcare. In 2010, the Affordable Health Care Act was passed by Congress, and beginning in March 2010, this act began to take action. The Affordable Health Care Act, more commonly known as Obamacare, has already changed many parts of our healthcare system and is working to help many young adults and college students such as us get health insurance. One part of the act that affects many of us in this room is the law that says that young adults can remain on their parents' insurance plan as a dependent until they are the age 26. So far, 3.1 million young adults have been able to stay on their parents' plan. Starting in 2014, if you do not have health insurance, you will be charged 1% of your taxable income on your taxes. So starting this year, on October 1st, the health insurance marketplace will open, and people will begin to get quality and affordable health insurance within their budget. The health insurance marketplace will allow people to shop for health insurance with as much coverage as needed. It will be easy to compare the different plans side by side, and all rules and fine print will be clearly written out and displayed. These plans cannot charge or deny a person for any pre-existing health care conditions or drop a patient when they get sick. Starting in 2014, if one's income is less than $43,000, people will be able to receive tax credits to help pay for their mandatory health insurance. In addition to this health insurance marketplace, everyone will receive preventative health care screenings and yearly checkups without having to make a copayment. As of 2012, women have been able to receive preventative health care with little to no cost. Over 3.5 million women have taken advantage of this, saving an average of $700 annually. By this time next year, the government hopes to see 47 million uninsured people in the U.S. to be on an affordable health insurance plan.